कि खुद ही को कर बुलंद इतना. Make yourself so strong and so large that हर तकदीर से पहले खुदा बंदे से ये पूछे, बता बंदे तेरी रज़ा क्या है. Means make yourself, you equip yourself so well that Vidhata, means the future, whatever has to be written line, she will come or the God will come and ask you, my friend, what should I write next and what you would like to, what is your desire? Good morning, friends.
Good morning.
Still loudly, good morning.
Good morning.
That's wonderful. So, I have been practicing for last 42 years. And I have been given 45 minutes, right?
Yes.
To talk on do's and don'ts in sexual medicine practice. I was wondering that how should I start? Those who are seniors and stalwarts, they know, ये तो हम सब कुछ कर चुके. I know all these things. But for a juniors, those who are entering and those who are senior, for both, this talk will be very useful. Juniors can learn something, while seniors, at the end of my talk, can give me some more input. So in my next talk, I can prepare it in a much better way. Let's start. Normally, what happens that at the end of the day in the valedictory session, you give a vote of thanks. But in sexual medicine, there is premature ejaculation. So before, I don't want to wait till that time. At the onset, let me congratulate Dr. Ajayan, Dr. Thareja, their team, and Lali and Mary. Please give them a big hand. I think you have done a wonderful job. In the morning, I phoned up Narendra Bhai Modi, that there is somebody who is vested in Kerala, please take him to Delhi. So you might get a phone by tomorrow. So let's begin. About 2 years back, there's a program which is being launched by Dr. S.S. Vasan, and this topic I had done it. But then I thought that it was quite dry. So I said, let me divide it into 3 parts. Maybe a case study. And as my previous, in the inauguration, they said that people were laughing when you use the word sexual medicine. So from that time, when nothing was available, not even a black and white TV, even a small page, if you have, you could be put behind the bar, that this is all pornography. So from that time, we have started. So the first part may be that, journey. Second part will be, if you want to open the clinic, what should be done? And lastly, what is going to be there, that it will give you an idea what don'ts you should do. So I'll try to cover it at the half time. Please, madam or Mary, please give me at half signal so I can complete it within 45 minutes. I thank you. This is the Mary. So please give her a big hand, I think. Okay. And Lali may be on the waiting at this, right. So let's start. What I have done, I said, I am never a perfect. The moment you think you are perfect, your whole progress ends. So I did one thing. I said, let me have some people. I asked many, but some of them who contributed to me is one from Kashmir, Dr. Vani. The second one, South, Ajayan Varghese. Then Mahendra Thareja, T.S.S. Rao from Mandya, Dr. J.K. Nath. I took from other Pati also that what they have to say. Because I always believe Bhavan's and the Rucha, what has been said in Rigved, Ano Bhadra Krato Yantaha, that all good noble thoughts comes to me. It's not that mine is good, but whatever is good is mine. So I asked Dr. J.K. Nath, Dr. Maldev from Mumbai, Dr. Rupin Shah, and Dr. Nilima. They contributed to me. And last but not least, Raju Sathe and Gadre. I think he has not come, he will be arriving. So I thank those. So like a bee, I went around the flowers, collected a nectar, and I'm giving you in the honey form. It's a very difficult thought that whether one should become a sexologist, yes or no. To be or not to be. You may be physician, cardiologist, diabetologist, psychiatrist, andrologist. You may be gynecologist, skin specialist, endocrine. So varieties of. So that is a period. Now there are three things. Why you want to do it? One thing, you want to give all the things which is available under one roof. If you're a gynecologist or a psychiatrist or a urologist. Second, it's your genuine interest. Third, you want to diversify it and do something different in this one life. And if you are at all thinking that I want to make a money, please get away from this. This is my first request to all of you. Now, how I started. I was also going through a period whether to do or not to do, whether to go for, and as Ajay has rightly said, that everybody used to laugh the moment you say that I want to be in the sexual field. And I remember initially, people used to joke when I go to our Andheri Medical Association, apna sexologist aa gaya. My relative said that dusra koi dhanda nahi mila, you didn't got any other business, so you are joining over here. So that was your ridicule. And I was attending one of the workshop. Professor Rishi Kumar Pandya, who is no more, is my friend, philosopher and guide, who was husband of an ex-wife of Pandit Ravi Shankar. And it was in Oberoi Sheraton, it was on communication recurring art. And in the afternoon, 4 o'clock, he said, you write it down, one line. This is very important message, that next 5 years what you will be. And I wrote down, I will try to be a sexologist. 15 minutes over, we came back from the tea. He saw this. Who has written this? Because to utter a word sex was very difficult. I said, sir, I have written, and I was the only medical person, and I am a doctor. He says, cut it off. I was wondering what he's asking me to cut it off. But then he said, cut it off, word try. Say, I will become a sexologist in next 5 years, and that's all make a difference. So next day while going, I thought, what should be the name of my clinic? Kama Institute of Sexual Studies. So past and present. So KISS, like WHO, the moment you read, you will remember it forever. So this is how. So I would say each one of you should try to have your logo, try to make something different, so you are being remembered the moment people hear about you. And once you thought of it, the next thing is the power. How you are going to equip yourself. Again, there are 3 words. One is money. If you're a Bill Gates, Adani, or Ambani, it's perfectly fine. Then you are being respected. Second is muscles, another M. All Bahubali. You can see what Yogi Ji has done to them. Or Dawood Ibrahim. And the third one, which is the most important for all of us, is mind. And Allama Iqbal, the great shayar who wrote Sare Jahan Se Acha Hindustan Hamara, he says, कि खुद ही को कर बुलंद इतना. Make yourself so strong and so large that हर तकदीर से पहले खुदा बंदे से ये पूछे, बता बंदे तेरी रज़ा क्या है. Means make yourself, you equip yourself so well that Vidhata, means the future, whatever has to be written line, she will come or the God will come and ask you, my friend, what should I write next and what you would like to, what is your desire? So I request you that you must, if you are entering into this field, you will go to learn everything as Ajay said, anatomy, physiology, psychiatry, urology, gynecology, endocrinology, and above that, it does not end over here. So the knowledge is in the area of expertise, as I said, and this is the length and breadth of knowledge. What my life thing has made difference is the breadth of knowledge. My any talk is never a dry, never a scientific. It will have past, present, philosophy, my personal experiences. And how do I get it? You developing with interacting with other and listening to them. So you will have to first listen to the people. We as a doctor, we were never told, and if you remember OPD days, hey, bola na, I have told you, go and take it. No. First thing, communication, communication, communication. Listen, listen, and listen. And unless you listen, it will never work. So I would say this is the first thing you should remember, and interacting with the patient. If Ajayan comes, I'll talk to him. What is happening in Kerala? What is your religion? It's not that I follow all the religion. What is expertise? What do you do in Catholic? What do you do in Protestant? What is the situation? Is it a patriotic society or what? Or if I'm asking Dr. Thareja, I'll ask whether the dowry system is still there or not. So that extra knowledge will help you understanding. You are not treating a disease or a dysfunction. You are treating a person which is behind it. And that's the most important part. That time nothing was available. So 1987, I went to San Francisco, the Institute of Advanced Studies in Human Sexuality. And I came back after 3 months, and the first thing, Juhu, which is the heart of Bombay, all actor, actresses, top rich people are saying, they invited Nanavati Hospital's owner, 3 generations sitting there, and no slide, nothing. And I was asked to talk on sex. And I was worried, and again in Gujarati. So I spoke. And at the end, there are always somebody who will pull your leg. He said, you are a doctor, but fine. But where is the course available? He was trying to equate me with the quacks. Dr. Akshay Mehta, who was sitting there, he was a leading cardiologist who is treating Amitabh Bachchan and Dalai Lama ji. He said, I am a cardiologist, and right now I have got a D-card degree. When my guru, M.J. Gandhi, started, he was just a physician. He got interested into cardiology. Somebody got interested into diabetes. Somebody got interested into gastroenterology. So that time there was no course available. When Raj Kapoor, Dilip Kumar, and Devanand made a film, there were no film institute. When Tenzing and when Hillary went, there was no film institute, the Institute of Mountaineering. So Dr. Raj is our pioneer. And that is what has helped me. Another great man, pioneer in the field of sexual medicine. He believed more are many. And Dr. Vatsa, we had a relation like father and son. We used to fight on a point. But he gave everything on my platter, and being in Bombay, I was very close to, he was in Bandra, I was in Andheri, Juhu. So we have wonderful, and he started the first course. And that time when he started, he had a different idea in Dr. Nagral. He said, this branch is not there. So what they did, they were doing a family planning association work. So in family planning association work, what was happening? That dies, even in a small village now, who does the operation? Only die does. And lot of infant mortality or immediately delivery people used to die. He said, we cannot give our qualified people, so why not we train them? This was the idea of bringing those non-qualified people. And what they taught? 4 lines. Saaf suthra haath, saaf suthra kapda, saaf suthra kaichi, or saaf suthra dhaga. Wash your hand, take a clean cloth, kaichi, scissor, and stitches. And this is how they have trained up. So what we did, that time it was different, now different, and after 25 years things will be entirely different. So it's a progress. Whatever we started yesterday, if you remember the telephone, if I want to call up Ajay, or even in Bombay, is route ki sub line, all the lines are not working, there is a cable fault. And today with phone, I can transfer money, I can do everything. So it's a